Hi, everyone. It's Naomi Wolf, and I'm really honored to be here with MPP Roman Bobber of York Center. Welcome, MPP Bobber.
Thank you.
It's great to have you. We reached out to you as one of Daily Cloud's Profiles in Courage because of your work in advocating for reopening Canada. Before I read the important letter you wrote to the Premier Doug Ford, Premier of Ontario, about lockdowns, I'd like to let everyone know a little bit more about who you are. Roman Bobber is the member of Provincial Parliament for the riding of York Centre. He was elected in the June 2018 Ontario election and currently serves as Chair of Parliament's Standing Committee on Justice Policy. Roman is a lawyer called to the Ontario Bar in 2006. He practiced law till his election because he's also very active on Twitter. And he wrote a much shared, much commented on letter on January 15th that started, "Dear Premier Ford, the lockdown is deadlier than COVID. The medicine is killing the patient," he wrote. "Ontario's hospital and ICU capacity are better than in the last 3 years. I write on behalf of my North York constituents and plead for the millions of lives and livelihoods ruined by Ontario's public health restrictions. The lockdown isn't working," he wrote. "It's causing an avalanche of suicides, overdoses, bankruptcies, divorces, and it takes an immense toll on our children. Dozens of leading doctors implored you to end the lockdowns. The crisis is largely limited to long-term care homes, LTC, with all LTC residents in, quote, red zones to be vaccinated by January 21st. Ontario should end the lockdown and the catastrophic toll it's causing Ontarians." And then at the end, I'm not going to read the whole letter. We'll embed it in the blog at the bottom of this video. But at the bottom, MPP Bobber reiterates what two other commentators have found independently, which is that if you do a breakdown of who's getting sick and who's dying of COVID in Canada, the numbers just don't justify locking down the whole country. 70 plus, that's where people really have a risk. But again, it's 0.054%. And so that is the gist of this initial letter. And then 3 weeks later, today, I gather, you wrote a follow-up letter saying, okay, the schools are starting to open, but you spelled out next steps. So why don't we start with why you wrote that letter?
Thank you, Naomi. Good to be with you. For the last several months, I've heard from hundreds of constituents and friends about the remarkable toll that Ontario's lockdown has been taking on them. And I've come to an unequivocal conclusion that the lockdown is doing significantly more harm than good. And I felt that it's an obligation for me to get the conversation started, since we essentially had no conversation in Ontario whatsoever, but not just the risk of COVID, which is a very real virus and can be very risky to certain populations, but also the remarkable toll that the unintended effects that the lockdown may take on folks. And about a couple of hours after the release of my letter, I was released. I was expelled from the Conservative caucus by Premier Ford. We have party discipline in Ontario as a British parliamentary system. And so regretfully, I now sit as an independent.
Wow.
I feel very at peace with my decision. It was the right decision. And my intent in writing the letter was to spark this much needed conversation and give cover to additional professionals that are afraid to come out and speak out, to actually come out and speak up. And I'm very pleased to tell your viewers that I'm cautiously optimistic that we were successful, in that for the last 3 weeks, the conversation in Ontario, which is Canada's largest province with 15 million people, has started to change. More Ontarians are gathering courage every day to speak out about the very real toll that the lockdown takes on their life. And since we have heard of many professionals, including 100 Canadian doctors, wrote a letter to all the premiers saying to reopen schools. And every day, more people are coming out and saying, we need to have a fair narrative, not just talk about COVID, but also talk about our public health response.
It seems like you do feel that that first letter and the subsequent conversation that I'm quite willing to believe was emboldened by it, helped move the dial in terms of opening schools and other policies to open society? Are other things underway to reopen Canada?
Just a couple of hours ago, one of the reporters broke a news story that Cabinet is now meeting and considering opening portions of Ontario for February 16th and other portions for February 23rd. This morning, before that, I wrote another letter to the Premier asking that we reopen, that all of Ontario goes back to work on February 16th. But there is no question that the letter had a terrific effect. Public health authorities sought that we hit all sorts of metrics before they would consider reopening. For instance, they wanted Ontario's case numbers to be reduced from approximately between 2,000 to 3,000 to under 1,000. The cases are at about just under 2,000 a day. They also wanted our intensive care units to essentially the numbers they're in to be cut by half. That hasn't happened. We're approximately where we were at the start of the lockdown. But the conversation changed, and I feel that the government is feeling significant pressure to allow folks resume their life somewhat, because what the lockdown has been doing to Ontarians is no longer sustainable.
Why don't you tell me what a typical day is like for people in Ontario? I mean, we interviewed someone who said, restrictions are so draconian from our point of view. What actually are the rules down there right now?
Yeah. So right now we're under a stay-at-home order. So this is an order enacted by Cabinet, not voted on by Parliament, that suggests that we are not allowed to leave the home except for essential purposes. And that includes school, if there's any, but there isn't any, work, and that means work as an essential service or frontline worker, and workers that cannot do their work from home. Otherwise, if you can work from home, then there's an expectation on behalf of employers that they facilitate work at home. You're allowed to go to medical appointments, grocery and pharmacy shopping, and you're allowed to go out for exercise. But even on good days, the streets in the cities are deserted, and it's simply heartbreaking, Naomi. What's now is becoming apparent, and finally the media is comfortable writing about this, because for some reason there was this dogma not to talk about COVID up until recently, or what the lockdown's doing, is the effect on people's mental health is simply astonishing. I quoted in my letter a study by the Canadian Mental Health Association that found that 10% of adult Canadians, even before the second wave, so in September, before this big lockdown, 10% of Canadian adults experienced suicidal thoughts or feelings.
Sure.
It's 4 times the pre-pandemic number. Among young adults aged 19 to 35, that number is 20%. Imagine 20% of Canadians 19 to 35 are having suicidal thoughts. That's catastrophic. We now have preliminary numbers from the city of Toronto, that's the largest city in Canada and a city where I live and a portion of which I represent, that found that opioid overdoses year over year are up 90%. Drug deaths from all drugs are up 67%. An oncologist at Princess Margaret Hospital, which is Canada's largest, most notable cancer hospital, suggested that cancer screenings are down 40%. So we are diagnosing cancer late, or we're missing a lot of cancer. I had an ER doctor write to me last week who said that he has never seen so many first-time presentations in his emergency room where he's finding cancer, and he has to tell folks that they're at stage 4 cancer and they didn't know they had cancer. And so what essentially I want to do, what I wanted to do with my letter, in addition to starting the conversation, is to get folks to understand that there's a whole equation on the other side of COVID, and that's the lockdown, and what that does by way of healthcare. My letter to the Premier, for which I was ousted from the Conservative caucus, was not about even business or jobs, which are destitute in the province of Ontario. It was about healthcare primarily. It was about the fact that our healthcare has been compromised. The fear is driving folks not to go see their doctor. There is no in-person healthcare anymore. All appointments are virtual. And we need to consider the health toll of lockdowns versus the health toll of COVID.
We interviewed Dr. Patrick Phillips, also a doctor in Ontario, who's also describing people coming in for checkups, and they were, as he put it, riddled with cancer, and he literally had to tell them that they had very little time left because there were no hands on them. So so you're one of the few members of the government that I've spoken to. We're starting to have members of parliament reach out to us, and I need to ask you directly, why? Like, you were there in the rooms where these policies were being crafted. Who thought this was a good idea? Is keep things as normal as possible, support those who need extra support. So you were there. Why is this happening?
Good question. And I think about that often, even though whenever we discuss public policy, I always suggest, let's not talk about why this is happening. Let's talk about what is happening and talk about whether it makes sense, because very often when folks disagree about why it's happening, they wedge each other a little bit. But here's what I think. This is a remarkable story. This is a historic occurrence. It started with a sensational story of a virus from China. And then folks started dying without us understanding really how much COVID is out there. So now we have this politically correct narrative, and we know that those are very, very difficult to escape these days. And that political narrative is now fortified. It's supported by cancel culture. That if you dare to question the narrative, that if you dare to suppose that maybe this political correctness is not apt at all to the situation, then you ought to be canceled. And so you have very competent doctors, public policy makers, nurses, other healthcare professionals, educators, academics refusing to speak out and say this is insane because they're afraid of being canceled, just like I was. I was canceled by the leader of my party and the premier of the province, but thankfully I received enough support from the people of Ontario to continue carrying on this conversation. We have convinced children that if they come close to another child,
oh God,
may die. We are raising a generation of children that may be afraid of normal life, this physical distancing element. And it's incredibly sad what we're doing to children. And in fact, that was one of the main motivations for my letter. I've heard from so many parents who told me that their child is depressed, that their child is anxious, that they feel estranged from their child, that their child may be gaining weight and not leaving their room. And it's an unsustainable situation.
I mean, thank you so much for that empathy. It's those stories of what this is doing to children that are the most indefensible.
More than 80% of folks that passed away in Ontario from or with COVID for what we call long-term care, basically nursing homes.
Right.
That's where the crisis is. And that's where the government has failed our eldest and most vulnerable folks in protecting. But instead of imprisoning 15 million Ontarians and making them sick, what we ought to do is we need to fix the crisis in long-term care. Yeah. But that's not what's happening. And instead, the presumption is and the suggestion is by government that we're all in danger of this remarkable virus, even though the deaths are primarily in nursing homes and in folks over 80 with one or more existing comorbidities.
I've been shocked to hear people I'm interviewing in Canada, including members of the press, say that there is fear everywhere around them if they speak out. That is not the Canada I know. And that only happens when there's a constricting of the message and penalties for speaking out. So how is that possible that formerly free, open Canada people are scared to have a peaceful disagreement about the right policy steps to take about this virus?
Unfortunately, we're seeing this happening not just in Canada, we're seeing this happening throughout the Western world. And specifically, it's this COVID dogma that has embedded itself so deeply into our thinking that people are scared that their professional careers will suffer.
Right.
As mine have suffered. I practiced law for 12 years, and at least until Parliament reconvenes, I'm chair of the Justice Committee, which is a very interesting, very challenging, and very influential committee. And it's any lawyer's dream to accomplish that. And So unfortunately, that will be taken away from me. And
I'm sorry.
uh,
But on what basis? You didn't lie. You didn't threaten anyone. What did you do that was so evil that you lose these prestigious roles and influential position in shaping public policy in Ontario?
well, it's not that I've done something. It's that I'm now not a member of the government anymore. I'm no longer a member of the majority.
But on what grounds can you be expelled for writing a letter that is not threatening insurrection?
So you serve inside caucus at the pleasure of the leader of the party, who's also the leader of the province, the premier. And he has ousted me 3 hours after the publication of my letter. The government accused me of misinformation.
Do you have freedoms of speech in Canada anymore?
No, you have freedoms of speech. I'm still a member of parliament.
Right.
Just asked not to sit with the conservatives anymore.
If you could roll out a policy for the next 3 to 6 months, what would it be? What should happen now? What can happen now? Where is there hope? How can Canada regain its democracy and freedom?
So those are two separate questions. The first one is my Corona framework, and the second one is where do I derive hope? So to your first question, I have proposed in my letter the following exit framework out of COVID. Number one, recognize and focus on where the problem is. The problem is in nursing homes. So make sure that you fortify your infection control, make sure that you provide enough staff, and we have staff shortages. The military is offering assistance. We should use that. And finally, ban workers from working, temporary and agency workers from working more than one home. They're carrying COVID from one home to another. So protect long-term care, number one. Number two, if hospital capacity is indeed an issue, and the reason they tell us that we have to stay home is to flatten the curve to prevent hospitals from being overwhelmed, which hasn't happened anywhere in the world but for Italy, that's number two, build hospital capacity. Number three, be objective and fair about the risk of the virus. And come clean. Come clean on the good news. Know that there's no more good news allowed.
Right.
Come clean on the fact that it doesn't transmit on surfaces.
Right.
The fact that it's probably airborne, not droplet. That it's probably, that we know that there's no transmission outdoors, almost no transmission outdoors. So why do we ban outdoor gatherings? So that's number three. And number four, lift the lockdown. To your second question as to why am I optimistic? I can tell you that I'm a lot more optimistic today than I was before I issued my public letter on January 15th.
Okay.
A remarkable conversation sparked subsequent to my letter. There's a different buzz in the air. There's a different tone in the air. And a lot of people that previously didn't have courage to say COVID is ruining our lives are saying that. And a lot of professionals, educators, doctors, nurses, law enforcement are speaking out against these draconian measures. And so I definitely have hope that as we normalize the narrative on talking about these draconian restrictions, that more and more people will feel comfortable making decisions that are in line with this normalization, and as opposed to the bizarre COVID world that we've been subjected to. And so the key is to keep the conversation going. We just need to have a sensible, well-measured, informative, and fair conversation about COVID, what the risk of COVID is, and what the implications of draconian public health measures are. And once that conversation is normalized, I have faith that we're going to come back.
Fantastic. And lastly, if people want to support you when they're hearing this, how would they do that? Do they go to your website? What's the pitch for support?
If they're in Ontario, then or in Canada, then we encourage them to sign my petition at romanbaber.ca, which would then help us identify them and get them engaged in our political effort to lift the lockdown. For our American viewers, I would probably propose to just take that optimistic message and remember that we can overcome this challenge, and we will overcome this challenge. We need to continue doing what we've always done, which is have faith, speak our mind, and stand our ground on what we think matters.
Fantastic. Well, we can't thank you enough, MPP Roman Baber. You can read his beautiful letter and the follow-up shortly under this blog, and you know now how to support him. And this is our 8th Profile in Courage. Thank you so much for all you're doing, MPP Baber.
Thank you so much, Naomi. Pleasure to be with you. Be well.